You're watching the Fox 11 News at 5.
Food and Drug Administration approved an emergency use booster dose today of Pfizer's COVID-19 vaccine for children.
Specifically, we're talking about kids ages 5 to 11. Fox 11's Hal Eisner in Sherman Oaks with details and what some parents are saying about all this.
Well, we've been to a couple of elementary schools today. This is Chandler Elementary in Sherman Oaks. Earlier, we were at Hesby Oaks in Encino, and that's where we got a real mixed bag of opinions from parents picking up their kids. Are you going to get it for your child?
Absolutely not.
Hesby Oaks Elementary School parent Mike Hanasab on the FDA's approval of a Pfizer booster for kids 5 to 11 years of age.
My opinion is stop pushing it on the kids, stop pushing it on the parents. Let everyone make their own decisions. Let's be done with it.
Not everyone picking up their kids at school felt the same way.
I know that my son is vaccinated.
And will you get a booster for your son?
Yeah, most likely.
I'm excited for it to some degree because they already had their first shot and second shot, and they felt empowered and, freer per se than before.
Just to be sure, that's all it is. I don't really believe in it, but I'd rather err in the side of caution.
I'm happy to hear that the FDA has approved this.
Pediatric ICU Dr. Rishma Shand says she's happy because, just like with adults, pediatric vaccine doses wane after time and drop off in effectiveness.
And especially during this Omicron surge, we've seen that the effectiveness of this initial vaccine dropped from 68% to about 12% against infections.
The doctor says she's had parents in her own practice that haven't wanted to get the booster for their kids, but she says she tries to explain to them the benefit, which to her is primarily the continuation of protection offered by the initial vaccines. As far as when your child should get that booster shot, if you're going to get it for them, it should be 5 months, according to doctors, after the initial primary series of vaccines, vaccine number 1 and number 2. Alex, Christine, back to you.